Good morning. This is Dr. Bill Wyatt again with the American Orthodontic Society, and I want to talk to you a little bit about T.M.J. pain and where most of it comes from. Now, this is my own beliefs. I've worked with for about 30 years with T.M.J. cases that came in with the orthodontics and took care of the T.M.J. cases in the office, or was for the last 12 years. I took care of all their T.M.J. work. And I'm not trying to pull your leg or anything, but we got everybody that I can remember out of pain, but we couldn't get them from clicking. In other words, the disc is out in front so far you couldn't stop it, and so you couldn't get it back unless you did surgery and pulled the disc back up over the condyle and sutured it in there, which is quite a lot of surgery to do. So we did no surgery, and I didn't get people out of the click. It would still do that. But I want to show you what I really feel like is the culprit in the pain that people have had with the T.M.J. joints. And I'm going to use some pictures of cut downs of the joint made by some Swedish dentist up there, and they've done a real favor to the dental society. Now, this is the head of the condyle right here, and this is the fossa right in this area. That's the eminence of it, but the fossa goes way up in here, and this is where the jaw stops. You chew, and the condyle will stop here, and I'm going to run through this so you'll understand where I'm talking about. This is number 2. They're opening just a little bit, and you see the condyle moving out here. And number 3, the condyle is right on top of the eminence of the fossa right here. And here's your biconcave disc that we call and talk of. And this is the tissue that it's connected to from this side, and also some down here on the bottom. Now, as the jaw opens wider, let me go through some of these. The condyle will move out kind of in front of the fossa, and that's when your mouth is open. In other words, it drops your jaw down from here to here. So now your posterior teeth and everything are in contact, and your anterior teeth, if you don't have a deep bite, they'll kind of work with each other where you can slide your jaw back and forth. And if you go to one side, this condyle will come out here, and the other one will go back in this side. You can feel that yourself if you just put your finger up slightly in front of your ear there, kind of open and close your mouth. You can feel this joint, and you can feel the condyles move, and you can kind of feel where the tissue is in that area. Now, when somebody has a lot of pain in it, they either get the disc hit real hard. Let me go through this and show all the way, and then I'll back up to that. This is number 5, and then number 6, it starts back, and number 7, it's back a little ways, and number 8, and then number 9, and you notice the tissue occupies this part up here, and the joint just kind of comes to that point. Now, this would be number 10. That's, as far as I could tell, is as far back as the jaw, the condyle goes. Now, it's back in this area right here. And this is the front part of that biconcave disc that's up there, and it's thick on both ends, and it that keeps the condyle and the fossa separated in here. There's an upper joint space and a lower joint space. Now, there's a fluid that comes out of the tissue back in here. This is highly vascular. I mean, a lot of blood vessels and nerves and everything in this area back here. But this portion of this disc, there are no nerves and no blood vessels. This takes so much pressure right here when you go to bite. Like if you bite on your front teeth out here and you bite down with 10 pounds of force, it probably takes 20 or 25 or 30 pounds back in the back because the muscle is closer. The muscle is much closer to the joint than it is to the teeth way out on the other end out here, and it takes more force back here. So this tissue is ungodly tough, but it has to be fed and has to be taken care of just like any other tissue. And the jaw joint is the most complicated joint in the body, and the thing that feeds, you have to feed it and you have to take away the waste product. Well, this is highly vascular back here, and it squeezes the fluid into this upper and lower jaw joint space. And when you push your jaw together kind of lightly, it shoves this material down into the to the disc and feeds it that way, and the waste product comes out and it carries it off and gets it back, and it's purified back in this retrodiscal tissue. You get tired of hearing me say retrodiscal tissue, but it's amazing the complication of this joint. Now, I'm going to erase all of this, and people get hit in the mouth, and if you don't have a mouthpiece in, it shoves the condyle back into this area, and it can really damage it. It can hurt it bad. Now, my little niece was playing basketball, and somebody came by with an elbow and hit her in the jaw joint, and she didn't have a mouthpiece in, and it put some real hurt on this tissue, this retrodiscal tissue that feeds the joint, and she started having pain with it. Well, this irritation and pain makes this thing swell up, you see, and it gets bigger back in here. Now, if you get hit in the jaw and you got ice pack on it real quick and you kept it from swelling, you would probably get over it quicker. But you've damaged this tissue, this highly vascular tissue back in here. Now, this stuff gets sore. I've had patients come in and you just go to touch them right here and they would jump. I mean, it was sore, it hurt. I've had my own hurt like that. I was skiing, somebody knocked the fool out of me, and it damaged my joint a little, and it was, you couldn't touch it hardly. Now, you can take anti-inflammatory drugs or something like that, or salves, and people give you all sorts of mess in there and don't get it what really caused this. But if you can get it, the swelling to go down and the pain to go away, it will stop hurting. Now, a lot of times people, like my wife, thought, well, this is just a bunch of hooey, all this, but she went in to get a lot of dental work done on her posterior teeth and had to open her mouth real wide, and it strained this area down in here, and she started having a joint pain. See, and so we knew what was wrong with it. We get over it in a while. If you have a wisdom tooth removed, the jaw joint can hurt for a while. Or if you have any kind of distal pressure on this causes this to be irritated. And if this gets irritated and you can't stop it from being irritated, you have to chew on it every day, and you swallow many times during the day and night. And every time you swallow, if you've got a proper swallow pattern, an adult swallow pattern, just try just try swallowing and not biting too. So you're biting too constantly and you're irritating the heck out of this, and this will flare up and get to hurting so bad that people, there's nothing you can do to just quit getting, unless you put a splint in and pull your jaw forward or put something to carry the weight back in here. You can do that with a splint. In other words, advance your mandible, bring this condyle out here, and fix it in a splint where it can't go back here, and yet your teeth come in contact with this splint here, so it takes a load in this part of the jaw instead of here. Now, if you just bite with your teeth, your front teeth, normally you're going to bite on the teeth out here in front, and the weight's going to be right here on this disc. And that disc must be tough as all get out, because I'm over 92 years old now, and my discs are still functioning, and so it's pretty darn good, tough tissue. Now, we know that people used to, and I've scrubbed in on cases where we screwed the jaw, in other words, wired it together rather. They later got where they put these plates on where you could move it like this. But when we wired it up there real tight and had the condyle pushing against the fossa up here, and it pushed it so tight, this tissue could not get fed. In other words, the synovial fluid couldn't get to it to bring it food or carry the waste product away, and you leave it like that for 2 or 3 weeks or something, whatever it takes for the jaw to grow back together, and then this tissue would just be dead. I've talked to old surgeons that had operated on cases like that, and this tough tissue was just like cheese or something. They could scrape it off like that and just scrape it. It was tough, and it died, and there's no nerve in it, no nerves in it, and no blood vessels, and you don't even feel the pain, you see, so you don't even know that it is hurting. But then your condyle, your head of the condyle, there's nothing there. It begins to rub bone on bone in here, and the synovial fluid kind of keeps it lubricated. Now that happens with a hard blow to the jaw, or you can put an appliance in somebody's mouth. I'm going to show in another video in a little bit how just not knowing how to retain teeth can cause this condyle to be pushed back into this retrodiscal tissue. I'll show another thing where a young lady that I worked on years ago and had nothing wrong when I started. She was class 2, and I put class 2 elastics in there, and maybe we had headgear. We were pushing the upper arch backward and bringing the lower jaw forward, and she started hurting, and I didn't know why. I'll get to that later on. But what it was, the teeth had something like this in them. It's not that plain, but I was trying to back up this part right here, and it caused pressure to get on them right here. And I sent this young lady to Dr. Weldon Bell, who's the knew more about the joint than anybody in the country at that time. He'd written 3 books on it, and I sent her to his office, and he wrote me a nice letter back and said, Bill, I don't know anything you're doing wrong in here, but he did not pick this up, and I didn't either. I just kept going, and after a while, the teeth got to where the point was right above here, and now the little girl would bite down, and it would move her jaw forward instead of backwards, and the T.M.J. problem went away. So we know that's the way it is. Now, let me erase all of that, man. The guy I worked for the last 12 years, or I worked at his office, Dr. Mike Worley, and I went out to eat with him one time, real before I knew him all that well, and he chewed on the back teeth for a little while, and then he would move his jaw to the front for a little bit and chew there, and then he'd go like this. And I looked at him and I said, man, what in the world are you doing? And he said, well, I go back here, my teeth fit together, but my jaw hurts. And so I move my jaw out here, I can chew, but I can't chew as good. So I just go back and forth like this. And I said, you've got a T.M.J. problem. You need to move the maxillary teeth further forward so that your jaw could come to a place where it was comfortable and could chew there. And that's where the whole thing comes together. Now, if you take, I've got a case that we've shown in there just recently, where the gentleman, the lower jaw could not go forward, and he was having terrific pain, and this man was under a tremendous stress. He operated the computers for American Airlines and their tickets and all this. He was in charge of that portion of it here in Dallas. And I just looked at him, I said, man, I know what's wrong with you. You just got a stress problem. You've got a tremendous stress problem. And but I saw the teeth were trapped back there, and he couldn't get his jaw forward. So we went ahead and did his orthodontics and straightened it out, got his teeth where they were freed up, and the jaw joint problem went away. He could handle the stress. He went back to his job, and it was not the stress that was causing it, but it was the position. He was having to force his jaw back to keep so he could chew. Now I had another lady who I did everything that I knew to do for her, and she finally quit her job and got relief from her pain. Her and her boss were just at each other's throats all the time, constantly while she was working. And that stress showed up in her body by a breaking down of this area in here. Now that was strictly stress, and the other guy had a ton of stress, but he was able to operate with it. So if you have somebody with pain back here, and you know it's here, I had one lady who, this was years ago, a very intelligent woman, had a television program here in Dallas called the Romper Room, and she spent thousands of dollars going to brain scans and everything else, had pain all over her shoulders and neck and head, and they never could find out. And we got to see her, and she had a jaw joint hurting. And so we fixed that jaw joint, and the lady got over all of the rest of this pain. Now, I learned something just recently and makes me think that if you got something that your body can't stop irritating it, it'll just get so bad it gets everything else around it in pain too. Now, my granddaughter she sings, and she's had some trouble with her vocal cords. And when your vocal cords get inflamed and really sore, and you can't stop using them, then that pain that she was explaining to me was very similar to what these T.M.J cases come in with all this pain. They've been hurting for years, and you can come in and move their jaw forward and take care of the position of the condyles and the fossa and get them out of pain. And it seems like you did a miracle on them. Now, so the pain is created in here, and the vast majority of it is stressfully related or trauma related, or something is pushing the jaw backwards, and you don't have to do anything. I had one person but make a thick crown on a central tooth and made it thicker. In fact, they didn't want to take the enamel off, so they just made the crown thick. Well, when they closed their teeth together, it hit that fat back of that tooth, and it made this tooth real sore on the bottom, and they pulled the jaw back, or they had to pull it back to get their teeth together, and that backward pressure on the mandible created the jaw joint problem from them. And it is such a idiotic thing to think that you don't do anything dentally that affects the jaw joint. And if you orthodontically move or do anything that causes the jaw to go back like this, to back it up to do it, then that is where the pain is. And you get rid of that problem. You get rid of that problem, and the pain will go away in 90% of them. I really don't know of anybody we didn't find out what was actually causing their pain and hit at that point, and you've got to pull it away and let it settle down. And when it gets through with the inflammation, you can sometimes back the jaw back up again, and it'll function in that area. Or else you have to move the maxillary teeth forward a little so that the teeth will fit together in a forward position, and that keeps the condyle from being back, and you're pushing on this area back here. And we got, to my knowledge, we got everybody out of pain understanding this joint. So I hope that this is not a real popular thing for people who are doing orthodontics to study and know about. I don't know why, because they have people who have pain in the jaw joint, and frequently they caused it, and they don't even know they caused it, and they don't know what to do with it when it happens. So I want you to learn how to deal with the temporomandibular joint, because you're going to have trouble with it if you do orthodontics or if you do regular dentistry or just anyway. I had a good friend who is he's an orthopedic surgeon. He and his wife is a nurse, and she was coming up with pain in it, and in her jaw joint. And I just talked to her about it. I said, well, don't go to sleep at night with your head on your chin and shove your jaw back like that, or don't sit around resting your head on your jaw joint this way. And she stopped doing those things, and the jaw joint problem went away. And here her husband was an orthopedic surgeon, a good friend of mine, and we had gone to school together, and he had not picked that up. And so the medical people for many years didn't seem to mess with this jaw joint problem, but I think today they're aware of it more. So I'm going to close out now, and I've fussed at you enough, but honest to God, this is something that every dentist, especially if you're going to do anything with the jaw, should know. I don't care if you're what kind of dental work you do. You can do something that causes the jaw to go back like this, and it bothers, and you got to bring it forward to get some relief from it. Now, I have found that if you let the person's jaw close where they want it to close, in other words, where they want it's comfortable to close here and this, then they just don't have any T.M.J. problem. And a lot of people bite and their jaw slides backwards when they bite, and other people bite and their jaw slides forward. Like if you went to bite and your jaw went out to the front, I have never found a person with that forward bite that had any jaw joint trouble. Now they could have arthritis and they could get trauma and get hit in the mouth and stuff like that. I think every athletic thing you do, you ought to be wearing a mouth guard so that you have your teeth together without, and locking the teeth together with a rubbery, forgiving a block in here keeps you from getting your jaw driven back into this tissue. And so I'm going to shut up and I'm going to talk some more later in another video about this and show you these things in dentistry that do bring it back and push it back on there. And certainly orthodontics does in many cases. And this is ridiculous to think that it doesn't. And I think everybody doing orthodontics or doing dentistry ought to understand this jaw joint. That's so I better close here. So I thank you for watching. I hope you'll join our channel and subscribe to it. And I want people to learn this. Everybody that does any work on people's mouths ought to understand that, or just, you don't sit around and rest your head on your chin like this. Your head weighs about 40 pounds, and you put all that weight on this condyle up against this tissue, and it irritates it frequently. So anyway, I'm going to say goodbye. I hope you get something out of this, but there'll be a lot of people don't pay any attention to it because they don't want to think, well, I'm going to do my orthodontics and I'm not going to mess with this T.M.J. stuff, or I'm going to do dentistry and I don't need to know anything about that. Well, this is wrong. You need to know something about it, and I'm going to shut up and get out of here. So I hope I fussed at you enough if you're a dentist to where you'll take that to heart. Thank you now. Bye-bye.